the Real McCoy Group, and our specific emphasis is on working with seniors around their Medicare health care decisions. Having said that, the big news with Medicare and Medicare Advantage as we move to the 2025 program is that there will be a change around the drug plan. Because of the law that President Biden passed in 21 or 20, maybe 20 or 21, effective January 1, no senior who's with Medicare will pay more than $2,000 a year, no matter what their drugs cost. That's a big win for us.
Yes.
It's a big win. Now, you guys feel free to just jump in and ask me questions as you see fit. One question I could ask you is most of the group, or let me say it another way. I will assume that everyone has Medicare, the red, white, and blue card.
Yes.
Yeah.
That being the case, as additions, add-ons, some people will have a supplement plan, and sometimes they'll have that through their municipal retirement, federal, state, or local government retirement plan. And that will be in addition to Medicare. The other big group will be those people who have the red, white, and blue card, but they have a Medicare Advantage plan. So one question I can ask you is, which is the program you want to hear more about?
The Advantage.
Medicare Advantage, they said.
Okay. I should say there is, in Washington, D.C., there is 1/3 group. People who have Medicare, the red, white, and blue card, and also have QMB, Qualified Medicare Beneficiary.
Yes.
Think of that as Medicaid for seniors. Now, one thing about that everyone should know is that the QMB program, in addition to Medicare, basically covers everything at zero cost. Drugs, they'll cost $1 here or 50 complete.
Hey, Greg, can you turn your volume up on your computer? Can you turn
I'm going to run upstairs to my desktop.
Can the
I'm going to go upstairs to my desktop.
You know there's a volume on that. Unless you may need to reschedule because
Listen,
difficult to
I'm
hear.
going to go upstairs to my laptop. I'm sorry. I'm going to go upstairs to my desktop. All I have to do is
Okay.
I don't see.
run upstairs to my desktop and try this again.
Okay.
Okay. Let's see. I think there was one. I think it was not.
Okay. She's got a remote too out. So yeah.
Well, it's up now to can you get 100? It's not giving me any numbers.
It's on the 99.
Okay.
That 99.
That's on there.
No, Beyond has a separate one, right? Beyond, yeah.
Because I turned mine down, it doesn't turn out.
Oh, there it is.
Yeah, that's this one.
There we go. That's you.
That should bring it up.
Okay, I'm up here at my desktop. I'm trying to get on right now.
Okay.
That actually means
That's better.
Much better.
Is this better?
It will be able to get you better. We turned it up here at our location.
Okay.
Okay.
So if you can hear me now, then I'll stay on this.
Yes,
Yes, please.
we can, please.
Okay. With that in mind, so just as a recap, what we talked about so far is as a basic as a basic start, people need to have the red, white, and blue card Medicare. The other category will be people who have Medicare, the red, white, and blue card, and some extra insurance, usually through a municipality, federal government, state government, and that will be normally that's called a supplement plan. It supplements, adds on to Medicare. So it covers financially the things Medicare doesn't cover. The third group will be people who have Medicare, the red, white, and blue card, and have Medicaid, specifically called QMB, Qualified Medicare Beneficiary. The first group, Medicare covers, has some deductibles, and covers everything pretty much 80%, leaving you 20% as your copay. That's how most people understand it. With the supplement plan, the add-on plan, that will pick up the cost that Medicare doesn't pick up. Now that costs you money, and it'll come out in terms of from your retirement check, they will subtract that every month. So people retire from government, for instance, they retire with the government plan and they're happy with that. And the only thing I tell them is just every year, pay attention to how much more money they increase it by. Because every year they're going to increase it. So I've had people who retired from the Postal Service. It was an older couple. They had retired in 91. I met them probably around 2015. So they had been retired a long time. By the time I met them, their premium between the two of them was $600 on its way to $700. That was a horse they could not drag any further. So we put them in the Medicare Advantage plan and they kept the same doctors, the same hospitals. For all intents and purposes, everything stayed the same for them and they saved themselves $600 a month. So the third group is the people who have Medicare and Medicaid. The big thing that I always want to tell people about the Medicaid in the DC area is that it's a very liberal dollar amount to participate. In plain English, if your income is under $3,600 a month, you can qualify for DC Medicaid. I can put a person in a program where all of their bills are paid up, everything's taken care of, they keep the same doctors, everything stays the same, they just aren't paying for anything. And they'll get a host of other benefits because Medicare is paying 80%, DC Medicaid in the form of QMB, Qualified Medicare Beneficiary, is paying the other 20%. That equals no money out of pocket. The big thing there is to understand that $3,600 is the magic number. Now, just to give you a difference, when I say that DC is very liberal, in Virginia, Maryland, Delaware, Pennsylvania, the dollar amount to qualify is under $1,200. That's a huge difference. That's a huge difference. And what we found is there are a bunch of people in DC whose income is $2,700 a month, $3,200 a month. They don't know that they qualify for a health insurance plan that would cover them in its entirety. So that's one point I want to make up. The second point I want to make up is that there's going to be a big change in the Medicare Advantage plans in 2025. And it's going to revolve around the drug portion of the plan. Starting January 1, no senior can pay more than $2,000 in a calendar year for drugs. That is huge. Let me give you an example. I'm 72 now. Every 3 months, I pay $400 for, I want to say Entresto. On the other month, I'll pay $350 for some other drug. I don't complain because they keep me healthy and God loves me, so I have the money. But $400 times 4 is $1,600. $400 times 3 is $1,200. So I very easily go over the $2,000 limit. What Medicare is saying is that I can't pay more than $2,000 in any given year. That's a big savings. Because it's a major difference, it's going to cause a lot of confusion. When you have a major change to a program that covers 65 million people, you can't make it simple. You can't. And Medicare covers 65 million people. It's going to seem very confusing. You are probably, we've heard about this, but this is kind of news in the sense that I'm telling you the insurance companies, the Medicare Advantage plans, are going to have to figure out a way to cap your expenses at $2,000. So if you're spending less than $2,000 a year, this benefit doesn't mean anything to you. But if you got any of the expensive drugs, you're definitely spending more than $2,000 a year. Now it gets split out, so it's not, and I guess that's easy for me to say. If I didn't have the money, it would be terrible. It gets spread out over time, but people are easily spending $3,000, $4,000 a year. That won't happen anymore. And they'll have ways to kind of modify the out-of-pocket cost, but it will be confusing. What I want you to remember out of this is that this new drug change works for the better of us. It absolutely does. It absolutely does. Now, feel free to ask me any questions. Medicare. Medicare is probably one of the first times where health care is evenly distributed. And here's what I mean. You have a heart procedure. It doesn't matter if you make $200,000 a year. Let me start over. You have a heart procedure, you're 70 years old, you have Medicare. If you made $20,000 a year, or if you made $200,000 a year, you're going to go to the same doctors and they're going to do the same procedures because they're getting paid the same. Now, the 1% of the rich who can write a $50,000 check to get a private doctor, they're always going to get better health care. They have the money. But for the overwhelming majority of America, over 65, we use Medicare. And if we use Medicare, Medicare has a specific schedule they pay the providers on. So I tell people, as long as you have good doctors that care about you, that make you feel they are invested in you, you're getting the same health care as everybody else. And if you're not, change your doctors. What kind of questions do you guys have? Because I'm from Brooklyn, I can keep talking.
We always hear about the Medicare Advantage plan A and B that you add on when you have insurance. I retired from the Commonwealth of Virginia, so I have a pension that I have to pay like a small amount for healthcare each month. What they're advertising on TV, does that change now with the new legislation or change in Medicaid?
In answer to your question, you retired from, I'm going to gather, some municipality in Northern Virginia.
Yes.
You have Medicare, the red, white, and blue card.
Yes.
And you have something that supplements Medicare.
Yes.
And when you go to the doctor, you go to the hospital, you've got very small copays, maybe no copays.
Yes.
Okay, so the only thing you want to pay attention to is how much they're taking out of your retirement check.
Okay.
Without even knowing you, I'm pretty sure it's been going up incrementally year by year.
Yes.
At some point in time, that's going to be too big a burden to carry. You can make it at that point, at the point in time where people tell me that they're concerned about the cost that they're paying for the healthcare, or they know exactly how much they're paying for the healthcare, then I'll tell them then it's time for you to think about a Medicare Advantage plan. If somebody
Okay.
tells me I don't know how much they're taking out my retirement check, I don't care. Well, in that case, you're fine, stay where you are. But I tell people if money is an issue, and saving a couple $100 a year is an issue, then taking a look at a Medicare Advantage plan is a good idea because there's no loss. How do I want to put this? There's no loss of service. So, let me ask you a question. Are you comfortable with the medical care you're receiving now?
Yes, I am.
You like your doctors, you like your hospital.
Yes.
Okay, so let's say your premium was such, let's say your premium had gone up to $300 or $400 a month, and that was concerning you. I can tell you beyond a shadow of a doubt that there's a Medicare Advantage plan that would replace that very high premium and give you all of the services you have right now.
Yes.
You would not notice a loss of any service. And the reason that I can say that is one, I've been watching the program for about 20 years, and I've been in the program for about the last, wow, time flies, 7 years. And just basically, I tell people this, you know Medicare works because nobody has read this story. Mama and them died because Medicare didn't pay the bill. No one has read that story because it doesn't happen. Medicare pays the bills. Now, they might be overly expensive, as a function of how much taxpayers pay into it, but they take care of seniors. They really do. The Medicare Advantage plan portion, and just let me describe the difference. Medicare, the red, white, and blue card is the government having a program where they pay your providers, your doctors, your hospitals directly on a schedule. So you go to a doctor, you go to your podiatrist. The podiatrist might say a visit to see me is $300. Medicare would say, no, we're going to pay you $125. And if you have just the red, white, and blue card, Medicare is going to say the $125 is what you're going to get paid, and we're going to pay 80% of that. So that's $24 off. So that's like $100. So Medicare is going to pay $100. You would get a bill for the other $24, $25. Now, you have a supplement plan through your retirement. It's going to pick up that $25.
Okay.
But what you want to do is make sure that you're not paying more for that supplement than it's worth.
Okay.
So if somebody tells me, Greg, I'm paying $250 a month, but I don't have any bills, I don't worry about anything. My response is going to be, you're spending $3,000 a year. Chances are, and we can check because you get a statement from, I want to say whoever your supplement plan is, they will send you a statement that has 4 columns on it. It's required by law. One column will be the amount of money the hospital, the provider charges you. The second column will be the amount of money Medicare approves for that procedure. The third column will be what your insurance company paid for that procedure and any difference. The fourth column would be you, any difference.
Okay.
That third column, what the company, the supplement plan paid, almost never goes above $1,500 a year. So if somebody tells me they're spending $150 a month, I'm going to say you're spending $1,700 a year to cover a $1,500 hole.
Yes.
Sir, question.
Oh, yes, I do. If you have, this is about Social Security. If you have, like a stroke or something, can you get apply for more money because you can't do like a part-time job you had because of that? Is that anything that I need to check into?
So let me see if I got the question right. You're getting Social Security.
Right,
You want to work?
I had a mini stroke. Stroke,
Okay. And
and so what I wanna know is because I can't do the part-time work I was doing to make extra money, can I apply for Social Security to send me more money?
rather than say what I think, I would say you'd have to call Social Security.
Okay,
I think I know what the answer is, but I'd say to call Social Security.
okay, thank you so
But
much.
pretty much, the number that they give us is the number that we pay based over our 10-year window that they've calculated. That's pretty much a hard number, but in your case, call Social Security. And in fact, pour yourself a cup of coffee. Make sure your speakerphone's working, so because you're gonna be there for a minute. Or you'll get somebody decent, and they'll walk you through it.
That's true. I have a question for you. With the Medicare Advantage plan or any other supplemental insurance, is it required if you get your care through the Veterans Administration?
No. No, it's not.
Because it's like, Medicare Advantage is going up every year. And I haven't used them since I've had them because I use the VA. So is there any law that says I have to have Medicare Advantage?
No. Not at all.
So
So
do
there's
I,
two parts of that.
so open enrollment, I can drop them like a hot potato?
That's a yes and a no. That's a yes and a no. Wait a minute. So, and it's interesting that you brought that up because now I can see what the companies are doing. So, and I always start out this way. You have Medicare, the red, white, and blue card.
Yes,
You use the VA for your medical services, for your
Yes.
prescription drug services.
yes,
You have a Medicare Advantage plan?
yes.
How much are you paying a month for that?
To a month. I forgot.
I'm sorry?
But it's more than I paid last year.
Give me a guess. What do you remember? What's the last number you remember?
200.
Okay, so number one, you don't have a Medicare Advantage plan. You have a supplement plan.
It's called a
There is no
Medicare.
$200. There is no $200 a month Medicare Advantage plan. If it's
Okay.
anywhere near 150 or up, that's a supplement plan. You definitely don't need that. Having said that, we should spend a half hour on the phone confirming what I just said. So I could ask you a bunch of questions to make sure, but I would say almost certainly you don't need Medicare and a supplement plan and the VA. You don't need all three.
Wow.
Somebody should have
What if it is?
talked so that I can walk you through it and show you in black and white what makes sense for you.
I have United Healthcare Advantage. I have
If
United.
you're paying $250, what you have is United Healthcare Supplement Plan.
I don't remember what I'm paying. So what if it's less? What if it's the other side and that it's actually less than, say like it's $50. What?
Okay.
What's the
So
alternative?
if you're paying between $35 and $50 a month, you've got a Medicare Advantage plan. Because Medicare Advantage plans get most of their money from Medicare. So they just charge us a small portion. In your case,
Do I need that with VA?
no, you would not need it. So what they've done is to create a Medicare Advantage plan geared specifically to veterans, where they don't charge you any money. They give you additional benefits you don't get from VA. And in some cases, they'll give you a buyback where they pay down your point B premium. So between $50 to $100 a month, they call it a buyback. They'll pay down your premium.
One of the things that I have is, United Dual Complete. And that pays for, I don't pay no copay for nothing. I pay for no copay for my medicine, that's free. Like when I go to the hospital, something like that, I don't pay anything. And, I don't pay them anything. And, I don't know if my QMB, I ain't asking no questions, they say I ain't have to pay. So,
You have the premier plan in DC. I sell the most of United Healthcare. There is no better plan for someone who has Medicare and some level of Medicaid.
it is, I
With
mean,
those
that's
two things,
not a minute, but it's sure good.
yeah. United Healthcare basically accepts every doctor in the DC area, every hospital. Their services are great and they give you a lot of extra benefits.
They give you, take care of your eyes, they take care of your teeth, they take care of your ears, your ear. Who does? United Dual Complete.
Are you using that U card to buy groceries every month?
Sometimes, yeah, sometimes I order stuff out the book they send. Cause they send a lot of stuff out the book that's cheap.
So that U card, you can go to Walmart and buy food.
I know, but I don't buy food out of the book, I buy things that I need for the house, like the things for the bathroom that you can hold on to, you know, the thing that you put up in. Bars, yeah. They pay for that, they give you the chair for the bathtub, they give you the one that you can step outside, they got a little shoe that you can step on. The little book has everything that you need, it has food. But, you know.
You can even buy gift cards.
Yeah, you can buy anything in your card.
I've told people if you run out of things for you to use in your house, then buy stuff and turn it over to the church because somebody needs soap.
You're right, but I need mine. I can't turn mine over.
So
Okay.
the moral of this story is if you're completely, absolutely satisfied with your plan, great. If you want to do a comparison, you're wondering if there's something better out there, it's worth a conversation. It's worth a conversation on the phone, one-on-one, 15 minutes just to get a feel that what I'm doing is the best thing for me. Because Medicare gives us the ability, let me say it another way. With Medicare, you've got a floor of health care. You've got a floor that you can stand on that's solid and give you good health care. Now you want to figure out, okay, if I've got a solid floor that I can stand on, how much is it costing me to have this protection? So the young lady I was talking to before, there's a big difference between $200 a month and $50 a month.
Ain't nothing.
At $200 a month, you're paying way too much. And you're not getting any extra health care. You're not going to get another doctor. You're not going to get another hospital. You're not going to get anything extra for spending that money. $50 a month. In your case, Sarah, well, you know, you're spending $50. Let's say you're spending $50 a month out of your retirement. There might be no stress and strain. I got the plan. I know what it is. It costs me $50. But at some point in time, it's going to go to $150. That's guaranteed. It'll go up every year. So you just want to pay attention to that progression.
Yeah,
And
I'm
when that number
retired,
becomes an annoyance, you have options.
I'm retired, but I'm not retired. I'm not officially retired, I just quit working. So I don't have any government anything. All I have is my 401 and my 457 and all that other stuff. And I do get a little pension from Virginia over here, a little bit over here, and a little bit over there. But I didn't retire from a municipality.
Well, Greg, at this point, I'm gonna give everybody in the room your phone number. If you give him a call, schedule a day to go through your individual circumstances. If you want to know more in detail, because he only can give you in general here and how it applies. So Greg's number is, everybody ready, Pat?
Let me say this. Let me say this. The reason you want to have an individual agent is because we come up to open enrollment, which is going to be October 15th to December the 7th. You get somebody on the phone, they say something cute to you, and they sign you up. Now it's August, and you have a question about the plan. And the day you call, you get some 22-year-old kid on the phone who is annoyed and is not listening to you. Or maybe you didn't ask the question quite the right way. And they tell you something crazy. And you get off the phone because you don't know what to do. Or they send you to somebody in Thailand that can barely speak English. The reason you want to have someone that you can talk to is for that moment. Because I tell all of my people, call me before you get annoyed. Something goes wrong, it goes up just a little bit. I tell people, call me then. Because we'll do a three-way call to the company so you can hear what the company says, and I can make sure what you wanted asked was what got asked and got an answer to the question you actually asked. That's why you want to have someone that you can count on for the time you need somebody to intercede on your behalf. So my name is Greg McCoy. I tell everybody to remember the real McCoy. I know I wrote it down. I apologize. The phone number is 202 573 7143. 202 573 7143. If anybody does the internet, I have a website called asktherealmccoy.com. Yep, asktherealmccoy.com. That'll come up. If you have any question at all, you send me a text, you call me on the phone. We'll spend some time, we'll chop it up and make sure that you ultimately are comfortable with the decisions around your situation.
I have a question. A friend doesn't pay any premium to Medicare or they don't withhold any premium from her check for Medicare. She doesn't pay anything with it. And I don't know what what income threshold is it?
Okay, for the District of Columbia, $3,600.
3,000. $3,600.
You mean for the year?
No, ma'am, per month. Per month.
Oh, for the month.
So somebody could be making more than $40,000 a year and qualify for a plan, qualify for government assistance that picks up all of the extra expenses around their health care. And that's only in DC.
Okay.
In the surrounding.
Yeah, she lives in DC.
Okay.
In the surrounding states, Delaware, Maryland, Virginia, Pennsylvania, the cutoff point is around $1,200 a month, which is only like $15,000 a year. That's a huge difference. Someone living under $1,200 a month, that's one situation. Somebody living under $3,600 a month, that's somebody who was married, the husband died, their income got cut in half, but they're still getting $2,500 a month, $3,000 a month. They don't know they qualify for benefits. And the last thing is, just to show you how language works. If you call DC government and ask them, do I qualify for Medicaid? And your income is $3,000, they're going to tell you no. And they're going to be right, because you don't qualify for full Medicaid at $3,000. You heard no, and you get off the phone. The correct question was, do I qualify for qualified Medicare beneficiary? Think of it as Medicaid for seniors. That answer would have been yes, but they didn't have the good sense to ask you, and you didn't know what the term was. So there's probably, at the last count, there's like 25,000 seniors in the district who would qualify, who don't know it. And with that qualification, the amount of money they're taking out of your paycheck every month for retirement, you can let that go. Any co-pays that you're spending when you go to the doctor, or you get a bill from the hospital for equipment or some service they provided for you, that's out the window. The United Healthcare Plan will give you $100 a month that you can spend in the grocery store, you can spend on utility bills, you can spend for over-the-counter drugstore items. They'll give you dental, vision. They will give you transportation. We call it Uber for the doctor. You call 3 days in advance, a driver, not a bus, an individual driver will come up, pick you up, bring you to the doctor's appointment, take you back. Gym membership.
Is this Advantage plan?
This is a Medicare Advantage plan.
They don't do
Yes.
that. Yes, they
I'm sorry?
do. Well, I must.
No. There's a break. If you have Medicare, the red, white, and blue card, so I just have Medicare.
Mhm.
The plan that I get has some extra benefits, but it's not as rich as your plan with QMB. They don't give me a card for $100.
I was trying to get a
They don't
ride to the
give-
hospital for surgery under a Medicare Advantage plan, and they say they don't do that. That's
Not
United
all
Health.
of them do it. Not all of them do it. Some of them do it, but not all of them. Specifically, the plans, if you have Medicare and Medicaid, those plans all include transportation. If you just have Medicare, the red, white, and blue card, like I have, like my plan doesn't include transportation. So the plans are richer when you have Medicare and Medicaid because they're getting paid by two government sources.
What is the requirement to have Medicaid?
$3,600 a month
Income.
income.
Yeah, so if you have more than that, you know,
You're out of luck on that program.
and you said 3,000 what?
$3,600 a month qualifies you. So where you have friends that you know aren't making that amount of money and they have Medicare and they're worried about their bills, you put them on the phone with me and see if you can help make their lives better. We have to do a better job of having more conversations.
Now,
We do a better job of that.
I know you're talking a lot about DC. Do you also have information on Maryland?
Yes.
Okay.
I work in all of the about 15 different states. The difference between DC and the other states is DC has a far richer benefit plan than any of the other states.
Yeah.
Yes.
In DC, I can make $40,000 and still qualify for help with my health insurance. That doesn't exist anywhere else. In Virginia, Maryland, Delaware, Pennsylvania, I have to be making less than $15,000 a year to qualify for medical assistance.
And so you're saying I should move into DC?
I told some people not to leave DC. Well, I've surely done that. Where a mother moves in with a daughter and leaves DC after being there 40 years. I said, man, you don't have to let the government know you moved in with your daughter.
Okay.
The last thing I want to say is this. you're being a veteran. We want to have a conversation come the fall because they've got plans that will actually give you additional benefits, won't cost you any money at all, and you can keep going to the VA. And if you decide you go to the VA, they give you an opinion that you're not too sure about. Well, you've got this Medicare Advantage plan, and for $35, you can go see somebody else and get a second opinion.
Well, I've done that. Yeah, I found it, it's $42 a month. But it went up from 25 and it went up to 42.
Well, okay, here's a homework assignment for you. You need to find out how much they're taking out of your check because that'll give me a better idea of what you have. Because if it's more than $100, it's not a Medicare Advantage plan, it's a supplement plan.
Yeah, it's $42.
$42 a month?
Yeah,
We can have a conversation about it because we could have a conversation about it and you could make an informed decision.
okay, it sounds good.
Yeah.
I'll be calling.
He's the boy.
Want to apologize to everybody for not being there. I will make up for it by giving you guys extra special attention.
Well, thank you, Greg. I'm glad that because you've always take good information. You always help really well, and we appreciate you. I'm glad you were able to join at least by Zoom. This is still a very helpful.
So much.
So,
Anytime you guys want anything at all, give me a call. I got one more baby granddaughter, and I promised her to take her to Disney World. And unfortunately, I can't do Disney World again. I have to do a Disney cruise. I can't walk the Disney ground again. So I got to keep working.
Okay.
All right.
All right then. All right,
Thank
and
you.
thank you so much. I appreciate
Thank you.
everything. All
Thank
right.
you. Bye bye now.
Bye bye.
Bye-bye.